National Registry of Emergency Medical Technicians. Advanced Emergency Medical Technician Psychometer Examination. Pediatric respiratory compromise. Takes or verbalizes appropriate PPE precautions. Verbalizes general impression of patient from a distance before approaching or touching the patient. Determines level of consciousness. Assesses the airway, looks for secretions and signs of foreign body airway obstruction. Listens for audible noises and voice sounds. Assesses breathing, checks rate, rhythm, chest excursion, audible noises. Attaches pulse oximeter and evaluates SPO reading. Note: examiner now informs candidate, pulse oximeter shows a saturation of 82%. Selects proper delivery device and attaches to oxygen. Administers oxygen at proper flow rate, blow by oxygen, non-rebreather mask. Checks pulse. Evaluates perfusion, skin color, temperature, condition, capillary refill. Obtains baseline vital signs. Note: examiner now advises candidate that patient begins to develop decreasing SPO, decreasing pulse rate, seesaw respirations, head bobbing, drowsiness, etc. Places patient supine and pads appropriately to maintain a sniffing position. Manually opens airway. Considers airway adjunct insertion based upon patient presentation or a pharyngeal or nasopharyngeal airway. Note: examiner now informs candidate no gag reflex is present in patient except airway adjunct. The patient's respiratory rate is now 20 per minute. Inserts airway adjunct properly and positions head and neck for ventilation. Selects appropriate BVM and attaches reservoir to oxygen flowing at 12 to 15 liters per minute. Assures tight mask seal to face. Assists ventilations at a rate of 12 to 20, one ventilation every 3 to 5 seconds, and with sufficient volume to cause visible chest rise. Ventilates at proper rate and volume while observing changes in capnometry/capnography, pulse oximeter, pulse rate, level of responsiveness. Note: the examiner must now ask the candidate, how would you know if you are ventilating the patient properly? Calls for immediate transport of patient. Critical fail criteria. Failure to initiate oxygenation within 30 seconds of identifying respiratory compromise. Interrupts ventilations for greater than 30 seconds at any time. Failure to take or verbalize appropriate PPE precautions within 30 seconds after identifying respiratory failure. Failure to voice and ultimately provide high oxygen concentration, at least 85%. Failure to ventilate the patient at a rate of 12 to 20 per minute, one ventilation every 3 to 5 seconds. Failure to provide adequate volumes per breath, maximum 2 errors/minute permissible. Failure to recognize and treat respiratory failure in a timely manner. Insertion or use of any airway adjunct in a manner dangerous to the patient. Failure to manage the patient as a competent EMT. Exhibits unacceptable effect with patient or other personnel. Uses or orders a dangerous or inappropriate intervention.